Welcome to the Florida Blue PPO Medical Benefits Overview. During this presentation we will discuss how the PPO plans work, review some basic insurance terminology, compare the standard PPO plan and the PPO high deductible health plan, help you understand where to go for urgent treatment, and share some tools and resources available to you. Let's get started. This slide is about commonly used insurance terminology. Calendar year deductible is the amount that some of your benefits apply to first, and this is the amount you pay first towards your out-of-pocket cost. Resets every year and runs January to December. Once you meet this amount, coinsurance would apply on benefits that do not have a copay. Copays are fixed costs for services, usually for office visits, prescription drugs, and do not count towards your deductible. Coinsurance out-of-pocket, this is the percentage of cost shared between you and the PPO plan. Resets every year and runs January to December. In-network global out-of-pocket max is the amount you will pay for in-network services in any given year, and includes deductible, copays, and coinsurance amounts. Also on this slide is some other medical terminology that you may familiarize yourself with, including per visit fee or P.V.F., per admission deductible or P.A.D., calendar year deductible or C.Y.D., and primary care physician or P.C.P. The state of Florida offers two PPO options: the standard PPO plan and a high deductible health plan. The standard PPO plan is based on predictable copays and has a lower deductible. The high deductible health plan has a higher deductible and lower premium. You will be responsible for 100% of the allowed amounts when seeing an in-network doctor until you have paid out of pocket the deductible amount, and then coinsurance begins to pay until you reach your out-of-pocket maximum. The high deductible health plan is a health savings account compatible. The health savings account allows you to save money tax-free to use for medical expenses, and you can roll over the money in your health savings account year over year. Let's review some benefits for the standard PPO plan. This plan has a $250 per person and a $500 family aggregate deductible for in-network, and $750 per person or $1,500 family aggregate deductible for non-network. Family aggregate means every family member's deductible amounts contribute towards the $500 max. For example, two people could each meet $250 individually for $500 total, or multiple people could each contribute a small amount that adds up to the $500 total. Coinsurance on this plan is 80% plan paid, and 20% member paid for in-network services, and 60% plan paid and 40% member paid for out-of-network services. That means any benefit that applies coinsurance, you must meet the $250 per person or $500 family aggregate deductible, and then the plan pays 80%, you pay 20% of the allowed amounts for in-network services. You are responsible for 20% coinsurance to a max of $2,500 per person, or $5,000 family aggregate out-of-pocket expenses. In-network and non-network coinsurance cross-accumulate towards the $2,500 individual, $5,000 family maximum. One person may meet the $2,500 coinsurance maximum, and their claims begin to pay 100% for the remainder of the year, excluding any copay services. Or multiple people could contribute small amounts that add up to $5,000 per family total, and satisfy for the family for the year. You also have an in-network global out-of-pocket max of $10,150 per person and $20,300 family aggregate, which includes all of your in-network medical expenses, deductible, copays, per admission deductible, and coinsurance. This is the max you will pay for in-network covered services in any given year for all of your covered medical expenses and prescription drugs when utilizing in-network providers. You have a $15 per visit copay for seeing your in-network primary care physician. You have a $25 per visit fee for seeing an in-network specialist such as an orthopedist or an endocrinologist. If you go to a non-network provider, you are responsible for 40% coinsurance based on the allowance, and you can be balance billed for the difference between the allowance and the billed amount from your provider. You will always find the greatest savings if you stay in network. Next we will look at the benefits for the high deductible health plan. This plan has a $1,700 per person, and $3,400 family aggregate deductible for in-network covered services. and $2,500 per person or $5,000 family aggregate deductible for out-of-network covered services. Family aggregate means every family member's deductible amounts contribute towards the $3,400 family max. For example, one person meets the $1,700 deductible and then coinsurance starts for that member. When the remaining members contribute small amounts to satisfy the total $3,400 family max, then coinsurance starts for the entire family. Coinsurance on this plan is 80% plan paid, and 20% member paid for in-network covered services, and 60% plan paid and 40% member paid for out-of-network covered services. Individual high-deductible plan members have a maximum annual coinsurance out-of-pocket of $3,000 for covered services. However, the family high-deductible plan has a family maximum coinsurance of $6,000 for covered services for a calendar year. It does not have embedded individual coinsurance maximum on the family plan. The only limit for an individual on the family plan is $7,700 for covered services for a calendar year. Your global in-network out-of-pocket maximum for any given year is the in-network deductible, plus in-network coinsurance amount. So, for an individual this means, $1,700 plus $3,000 equals $4,700. Or for a family $9,400. No one person will pay more than $7,700 in meeting the global in-network out-of-pocket maximum. If you go to your in-network doctor, there is no per-visit fee. You pay 100% of the allowed amount until you reach your deductible. After you reach your deductible, you pay 20% and the PPO plan pays 80% of the allowed amounts. This is the case for all visits and services other than preventive care, which is covered at 100%. If you go out of network, you pay 100% until you meet your non-network deductible and then you pay 40% coinsurance. However, you can also be balance billed by your doctor for the difference between the allowance and the billed amount. On the left-hand side are the similarities of both plans, however, let's focus on the differences. The calendar year deductible is different. As we discussed on previous slides, the standard plan has a lower deductible. Both plans have different annual coinsurance and global and network out-of-pocket maximums, the amount you might have to pay for all of your medical and prescription drugs in any given year. And lastly, the high-deductible health plan's calendar year deductible must be met before the PPO plan begins to pay. The only exception is for preventive child and adult wellness services. Telemedicine is the distribution of health-related services and information via electronic means. Virtual visits offer immediate care and saves cost and unnecessary ER visits. Virtual visits are a convenient way to deliver and receive care from physicians who have these capabilities. You have two options for telemedicine: virtual visits. Teladoc, a vendor contracted with Florida Blue, is available 24/7, 365 days a year. You can speak with a doctor who is able to listen, diagnose and prescribe medication, if medically necessary. Teladoc Health licensed therapists and psychiatrists are here for you no matter what you are facing, whether it's big or small. Dealing with a rash, acne, eczema or another skin issue? Start an online skin review with a dermatologist by uploading images and details of your concern. You will need to set up a Teladoc account and we recommend you doing so prior to you needing care. You may download the Teladoc app from the Apple App or Google Play stores. Or your current in-network or out-of-network provider may also conduct visits through an audio or visual, telehealth, method. Just ask your provider if he or she provides virtual visit services and if your service is suitable for a virtual visit. For more information on telehealth or virtual visits, call Florida Blue customer service at 800-825-2583. Be a good consumer of your health plan and know your options. On this slide we like to highlight your different treatment options for when it is late at night and you are not feeling good. Or it is the weekend and your doctor's office is not open. You have options. Teladoc can be used 24/7 for conditions like an upper respiratory infection, sinus infection, common cold or cough. This is the least expensive out-of-pocket option for you. The urgent care centers, which are less expensive than the emergency room for you in the PPO plan, have shorter wait times and can treat you for things like colds and flu, sprains, strains, breaks, or mild burns. Lastly, the emergency room. Going to the ER when you have a non-life-threatening condition can result in longer wait times and the highest out-of-pocket cost for you. We do want to stress if you experience a life-threatening emergency, call 911 right away or go immediately to the ER. You should go to the ER if you experience chest pain, have signs of a possible stroke, severe or sudden shortness of breath, or you lose consciousness. This slide highlights the PPO plan forms and brochures that are stored on the Florida Blue member website dedicated to the state of Florida, also called the microsite. You do not have to log in to use this public website. You can select, find a doctor from the microsite, however you have to manually select, blue options for the network option in the drop-down menu to conduct your search. Not pictured in this slide, but scrolling further down within the microsite, you can find information and resource websites. For example, information regarding our online wellness program, Better You Strides, 24-hour nurse line, as well as descriptions and contact information for Healthcare Blue Book and Surgery Plus. These are some value-added benefits and resources available to you that we like to highlight. Most members do not realize they have access to a nurse 24/7 365 days a year to discuss symptoms and whether or not they need to seek immediate care. We also have care consultants that are here to help you navigate questions about a condition or explore different treatment options. We are here to help guide you and answer any questions. The Healthy Edition program is a prenatal education and early intervention program for expecting moms. Blue 365 provides you with access to discounts for fitness programs, nutrition programs, exercise equipment from a variety of heart monitors to footwear, etc. Lastly, you can download the Florida Blue app where you can also access your claims, your ID card, find a provider, etc. Lastly, this slide includes important contact information. You have the Florida Blue customer service toll-free phone number dedicated to state of Florida PPO plan members. You also have the toll-free phone number to use when you are looking for a doctor outside of Florida or internationally.